What does informed consent for clonazepam, otherwise known as Clonazepam, look like? My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and I talk a lot in this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing when clinically appropriate. And I've been going through a series where each day I go through one of our most commonly prescribed psychiatric medications, and I go through the informed consent process, as I would with one of my patients. So today we're talking about clonazepam. So clonazepam is a long-acting benzodiazepine. Its onset's going to be after about 40 to 60 minutes, and it has a duration of action of about 8 to 12 hours. This medication can be dosed as needed. This is the lowest risk way to take this medication. It can also be dosed once, twice, or up to 3 times daily. It's FDA approved for seizure disorders and for panic disorders, but it has a lot of off-label uses as well, things including bruxism, meaning grinding your teeth, other anxiety disorders, insomnia, restless leg syndrome, acute mania, akathisia, and tardive dyskinesia. Clonazepam is not lipophilic like something like Valium, which means that it's not going to have as abrupt of an onset and offset, which is better for things like rebound anxiety as well as reinforcing effects and basically abusability of the drug. But it certainly can be dangerous when there's too much taken or when taken in combination with other CNS or respiratory depressant medications. As far as side effects, it's going to be the same as I would warn anyone about for a benzodiazepine. So that's going to include things like dizziness, sedation, drowsiness, difficulty with coordination or unsteady gait. There can be cognitive changes as well as mood changes. Typically, this medication is going to calm someone down, but every once in a while, it's going to have a paradoxical reaction where someone might actually become more agitated or aggressive when they take this. Sometimes there can be nausea, increased salivation, headaches, and muscle aches. Of course, with any benzodiazepine, there are the risks of tolerance where you need a higher and higher dose to get the same therapeutic effect, as well as dependence, which happens when you're taking the medication regularly, your body is used to it. And so when you try to stop the medication, it can lead to withdrawal symptoms. And of course, there's the risk of withdrawal, and the acute withdrawal from benzodiazepines can be very dangerous and potentially deadly. It can lead to things like confusion, unstable vitals, seizures, and eventually coma and death if severe enough and not addressed. So that's the acute withdrawal period. Now, there's also the risk of something called protracted withdrawal. We often associate this with something called benzodiazepine-induced neurologic dysfunction, or BIND, when it comes to benzodiazepines. But it's basically a whole host of symptoms that can almost affect every system in the body. And this happens if someone is tapered off too quickly. So we're definitely going to recommend a slow hyperbolic taper approach with clonazepam, as I would with any benzodiazepine. We don't generally recommend the use of benzodiazepines in elderly populations because of the risk of cognitive impairment as well as falls. That being said, if someone's been on a standing benzodiazepine for a long time, there are also risks to discontinuing it. So it's something where you always have to be weighing the risks versus benefits for that individual. And after going through all this, I would answer any questions the patient might have, and we would go forward with a shared decision from there. If there's another psychiatric medication that you want to hear me go through the informed consent process for, then please put it in the comments below. I'm also putting together an email list for those of you who are interested in my content, because I may have future courses or offerings that I want to be able to communicate directly with you all about those things. So if that's you, send me a DM with your email, and I'll see you in the next one.